Goni skill shoulder extension. Position the patient prone with the face turned away from the shoulder being tested or face down on the plinth. A pillow is not used under the head. Position the shoulder in 0 degrees of abduction, adduction, and rotation. Place the elbow in slight flexion so that the tension in the long head of the biceps brachii muscle does not limit the motion. Position the forearm in 0 degrees of supination and pronation so that the palm of the hand faces the body. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to extend the shoulder. The plinth and weight of the trunk stabilize the thorax to prevent forward flexion of the spine. Assess the trunk for rotation of the spine. Extend the shoulder by lifting the humerus off the plinth. Maintain the extremity in neutral abduction and adduction during the motion. While the trunk is stabilized to prevent flexion and rotation of the spine, the end of shoulder complex range of motion occurs when resistance is felt and additional motion causes flexion or rotation of the spine. Assess the end field of the joint. This is firm because of tension in the sternoclavicular joint capsule and ligaments and in the serratus anterior muscle. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral aspect of the greater tubercle. Recall the technique taught in lab to locate the greater tubercle. Align the stationary arm parallel to the mid-axillary line of the thorax. Align the movable arm with the lateral midline of the humerus using the lateral epicondyle of the humerus for reference. Ask the patient to perform extension of the shoulder as done previously, maintaining the goniometer in alignment through the entire range of motion and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 60 degrees.